Good morning, and thank you for joining me today. I'm honored to have our city's public health and medical experts, Savannah's Dream Team, with me this morning to provide an update on Savannah's COVID-19 situation. Obviously, these are individuals that you are well aware of. Dr. Lauren Davis, of our District Health Director, Dr. Julia Michael, Vice President of Medical Affairs for St. Joseph's Candler, Dr. Stephen Thacker, the Associate Chief Medical Officer for Memorial Health, Dr. Carolyn Elin, Chief Clinical Officer for Curtis Cooper Primary Health, Dr. Renee Dowse, the CEO of J.C. Lewis Primary Care, and Dr. Erica Russell Petty, a private pediatrician, and then of course our Assistant City Manager Heath Lloyd. Epidemiologic evidence demonstrates that here in Savannah, the rate of community transmission of COVID-19, hospitalizations, and positivity rates have all substantially increased in our community since July the 1st, 2021. During the past month, increased interactions among members of the public have resulted in an increased number of new daily COVID-19 cases here in Savannah, Chatham County. Daily cases are on a steep and alarming rise. Based on the Federal Centers for Disease Control and Prevention indicators and thresholds, community transmission of COVID-19 within Savannah, Chatham County is now considered high and highly likely to increase during the coming days and weeks. Case rates are also rising dramatically in surrounding counties and across the state of Georgia. Consider this. As of last Friday, the Community Transmission Index, which we know is the number of confirmed cases in the last 14 days per 100,000 residents, was 230. 230. To put this number into context, on July the 9th, our Community Transmission Index was 76. Our neighbors in Effingham County have a Community Transmission Index of 208. Our neighbors in Bryan County have a Community Transmission Index of 294. And for perspective, Camden County has a community transmission rate of 809. You think about that. Keeping in mind, these are the rates as of Friday at 3 p.m. The rates are updated, so we expect that to even be higher than what I'm quoting right now. Our latest 7-day rolling average of newly reported cases is 62.6. We dropped to 7.3 on June the 28th, and in less than a month, we are at 62.6. We have not been this high since March the 11th, when our 7-day rolling average was 64. We currently have 40 COVID hospitalizations at Memorial, 20 COVID hospitalizations at Candler, and 16 COVID hospitalizations at St. Joseph's Hospital. I am told that this sharp increase is likely the result of several contributing factors. One, the circulation of the more contagious Delta variant. Two, our relatively low vaccination rate. 3, gatherings and events like the July 4th holiday. And finally, many people have just let their guard down. They've stopped masking, they've stopped social distancing, regardless of vaccination status. We know now that the Delta variant is now the dominant variant of the COVID-19 virus in the United States, and now may spread 225% faster than the original virus. And yes, we are also experiencing some what's called breakthrough cases, meaning that there are people who have been vaccinated who are getting mild cases of COVID. We have said all along that the vaccine is not 100% effective at preventing the virus, but it is almost 100% effective at preventing more sickness. If you are fully vaccinated and you develop a breakthrough case of COVID, you are less likely to spread it to others and less likely to get severely ill. So as much as we want to put all of this behind us and put COVID-19 in our rearview mirror, COVID has not gone away, and now we have a variant that is even more transmissible. The more people that get vaccinated, the less chance a variant will emerge that's vaccine resistant. We also know that masking works, and it's a part of a layered strategy to prevent the spread of illness. And even though the CDC says that fully vaccinated individuals do not have to wear a mask in public, there are exceptions. The CDC acknowledges that even fully vaccinated individuals should consider wearing a mask if community transmission rates are high, particularly in crowded outdoor settings and for activities with close contact with other unvaccinated people. Although 41% of Chatham County residents are fully vaccinated, that means for us the majority of our citizens are not vaccinated. Additionally, anyone under the age of 12 cannot be vaccinated yet, so they are still vulnerable to COVID-19. While young people tend to have a less severe illness if they get COVID, they can still get sick and die from this disease, and they can certainly contribute to community transmission. As long as our vaccination rates remain low and our transmission rates remain high, I intend to wear my mask in public places and support any effort to stop another surge. While masking does help, the best way to prevent the spread of this disease is to get vaccinated. Last year, around this time, we were just praying and hoping for some breakthrough to be made. And we got that breakthrough in vaccines that we know work. And now people are just not taking advantage of this breakthrough. I want to emphasize that vaccination remains free and safe, and we have plenty of vaccines available. If you're 12 years or older, we're asking you to visit your family doctor, a pharmacy, a health clinic, the Savannah Civic Center on Thursdays, or the health department to get vaccinated. If your doctor does not have the vaccine, you can visit any county health department in the coastal health district anytime they are open. You do not need an appointment to get the COVID vaccine. None of us want to take a backward step in our return to normalcy, but wearing a mask is simple, easy, and the most inexpensive thing that we can do to protect ourselves and those around us until more of us get vaccinated and acquire immunity through infection. So we found ourselves in a place, in a position that we thought we had put into our rearview mirror. In Savannah, we've always said that we would keep the faith and that we would follow the science. Remember, it was the science that led us to close our businesses and radically alter our city operations. It was the science that led us to work with our business community in developing the Savannah Safe Pledge, which was a voluntary partnership to collaborate with and encourage local businesses to follow safety measures to keep their employees and their customers safe. It was the science that led most of our faith leaders to refrain from holding in-person services in Savannah's churches, mosques, synagogues, and temples for well over a year. It was the science that led us to issue the very first mask mandate in the state of Georgia. And it was the science that led us to lessen our restrictions and downgrade our mask mandate to a mask advisory, asking the unvaccinated and those most vulnerable to continue to wear a mask. As we prepare to return to school, an updated guidance from the American Academy of Pediatrics strongly recommends that in-person learning continues and that urges all who are eligible be vaccinated to protect against COVID-19. In addition to vaccinations, the AAP recommends a layered approach to make schools safe for all students, teachers, and staff in the guidance, which includes a recommendation that everyone older than 2 wear a mask regardless of vaccination status. Given our current situation and based on the advice of these esteemed medical professionals behind me, I have ordered the reinstatement of Savannah's mask mandate effective immediately. This requires everyone, regardless of vaccination status, to wear a mask indoors when you're with people who are not in your immediate household. Masks are hereby required in city government facilities, early childhood, elementary, and secondary institutions. We recognize that the City of Savannah has no jurisdiction over private schools and no jurisdiction over the Chatham County Board of Education, but we do have a great partnership, and I am asking their consideration to require masks in schools that are in the City of Savannah. I can't do anything about schools outside of the city, but if a school is in the City of Savannah, I'll be asking the school board and superintendent to consider requiring masks for schools within the City of Savannah limits. Hospitals, which they already do, I've been there a couple of times in the last week, and masks are still everywhere, and thank you all for that. And of course, it's still required on federally regulated transportation. At this time, we will continue to allow gatherings in the outdoor public space, provided that adequate safety measures are taken. We will continue to monitor our situation and determine the status of various public events or events in the public space for the remainder of the year. So I know the question will come. Here we go again. The question will come, are we effectively punishing those who did the right thing, who took the vaccine? And the answer is yes, we probably are. But the minority is being punished because of the inaction of the majority. We have the ability to determine our own fate, our own destiny, by doing what we can to improve our vaccination rates, and certainly, if not improving our vaccination rates, to decrease the spread of this virus by simply wearing a mask. I'm asking people, don't complain, get vaccinated. Don't complain, wear a mask. And as the science has been, when the numbers indicate that it's safe to remove the mandate, then we'll remove the mandate. But as it is right now, we're back where we are. And we will be talking with our health professionals on a regular basis as it relates to outdoor activities. And again, a lot of people have planned a lot of stuff for the remainder of the summer and the rest of the year. We don't want to go back there. So how we handle this place where we are now will determine how our rest of our year will turn out. We've come too far, and we've done so well. Our businesses are booming, and things are looking up for us to go back here. But as far as I'm concerned, our first priority is to keep our citizens safe, to keep our employees safe, to keep our employees that are working in the hospitality and tourism industry safe, and to certainly keep our visitors safe. So as for me, the short and long-term health effects associated with COVID-19 are too high, so I chose vaccination, and I hope you will too. We need to, we must. It costs everyone too much to go back. So if any of these folks would like to make any comments before we take questions, we'll certainly afford you the opportunity to do so. And don't jump all up and say, anybody?
I would just like to say, I would just like to say that at Curtis V. Cooper, we have all 3 vaccines available. No appointment is necessary, and we're doing them Monday through Friday. You can call for an appointment or you can walk in. Thank you.
And I would just like to say on behalf of J.C. Lewis Primary Healthcare Center, we're now in the Oglethorpe Mall vaccinating Monday through Friday from 11 to 5 p.m. We too have all 3 vaccines. No appointments are necessary. So come get vaccinated, and we encourage everyone to be vaccinated. Again, we have all 3 vaccines, and we're in the Oglethorpe Mall till October the 15th.
And I'm Dr. Erica Russell Petty, pediatrician here in Savannah and president of the Georgia State Medical Association. As the mayor stated, that the American Academy of Pediatrics recommends that all children over age 2 should wear a mask, as well as all the staff and of the schools. We have seen an increase in pediatric cases of COVID over the last few weeks. There are at least 5,000 new cases reported now per week. Here locally, we have seen an increase in positive cases and hospitalizations due to COVID. We have had about 350 pediatric deaths in our country due to COVID. In February 2021, in our country, there were about 2,000 reported cases of multisystem inflammatory syndrome in children due to COVID. This is doubled to now over 4,200 cases of this multisystem inflammatory syndrome in children due to COVID. As you may have heard, this past weekend, we buried two parents of two of my teen patients. They died within hours of each other due to COVID. They were not vaccinated. For anyone who has been hesitant about getting the vaccine, the wait and see what happens time is over. If you still have questions, we will have a vaccine clinic at my office tomorrow from 10 a.m. to 3 p.m. along with J.C. Lewis, mobile van for anyone 12 years and older. My office is 361 Commercial Drive. We need to wear a mask, get vaccinated, and pray to help limit the devastation of COVID.
It's also important to note that Saturday I was at the Public School Expo at the Savannah Mall, and they had a huge vaccination clinic going on. I understand upwards of 200 people, parents and young people, were vaccinated. We have the ability, we have the wherewithal to do this, and so we just need to go ahead and get it done. My fear is obviously that we don't have as many of our public professionals vaccinated as we would like, and it's very easy for us to have a huge surge. Beyond that, when you look at our neighbors around us, many of them who come to Savannah to live, work, and play, well, to visit, work, and play, they're coming from places that are hotter than us. Again, to have an 800 community transmission index in Chatham County is just unbelievable. And so some of these folks invariably come to Savannah, Chatham. And so we need to do what we can to help keep our citizens safe. So we'll entertain any questions, and I'm sure they'll answer any questions that you might have.
Morning, sir.
Good morning.
Just right off the bat, will this be the same in terms of language, verbiage, as the last mask mandate?
A little bit different, but the intent is the same. Again, the difference here is that we're requiring them in indoor public spaces. We're asking businesses to help take care of themselves. Again, if they have an outbreak in their business, that means they're closed for an indefinite period of time. We have shown in this community that masks work. And I think that Dr. Davis on multiple occasions, and Dr. Toomey today, talked about how Savannah getting in front of COVID with a mask mandate helped to limit our transmission rates. I think this thing just died. I think it died. I hope it doesn't have COVID. I think the plug came out. Thank you. So we're asking for our local business community, we're asking for our faith community, again, to do the things that got us to the point of where we were. Savannah was able to open faster and at a better rate than most of our neighbors because we had taken the necessary steps up front.
Will then we see certain programs or initiatives come back that were in place with the mask mandate to include the park? program at that time?
The what?
The parklets for a restaurant?
Not at this time. Again, the parklet program was instituted because of reduced capacity, not because of mask. Obviously, if our numbers don't improve, we might reduce capacity. So it just depends on where we are. We have tried to implement and be very thoughtful in our approach, and so what you've seen from us is a layered, multi-step approach. So we're trying mask first, we see how our numbers are. If not, then we have to do something else. So right now, we do not have capacity limits. We're just asking for people to wear a mask.
And as far as any events permitted for indoor venues that are in public spaces, all those are still in place as well?
They're still in place at this time. Again, where we go from here depends on what we do from here. If our vaccination rates go up, our infection rates go down, we keep on rolling. If our vaccination rates continue to lag as they have, if our infection rates continue to increase, then we're going to have to make some changes, and that could include cancellations of some events. We're going to react to what is presented to us.
Thanks.
Good morning.
Good morning.
Have you talked to the business community? What's their reaction to this?
They understand. They understand. Again, people are not going to be happy, but in the end, we have to have safe people. We have to have safe people. The best bottom line for businesses is for people to be safe.
I have a question for Dr. Davis and Dr. Thacker, however you want to do it. Dr. Thacker, can you talk a little bit about how many cases you have at Memorial and why your mask mandate will work in the context that most of this issue is about people going in and sitting there and eating, and they do take the mask off sometimes. So how can it happen?
Gotcha. So,
can you hear me okay? No? Okay. So, to really echo a lot of the great points already made by members of the medical community behind me, as well as excellent points made by Mayor Johnson, that that we know that masks work, right? We've proven that locally, we've proven that nationwide, and so it's not just in an eating environment, a restaurant environment where we're seeing spread. There are gatherings amongst folks where there's unknown vaccination status of others, and then there's a growing concern around the effectiveness of vaccines moving forward. So how do you manage through that while we try to get to the answer of indeed how protective are our current vaccines? You protect people. You use what you know works, and that's a combination of layered safety, which includes masking and a robust vaccine campaign. And as far as to your first question about number of cases, at Memorial we had 36 total cases this morning. The average age skews a little bit younger than when we were at the peak of our pandemic, around age 50. And really what that tells us is that we're seeing less individuals who are vaccinated by far and away because we had less adoption. Once you get below 55 in many communities, the rate of vaccination drifts quickly.
Can you tell me, you say 36 this morning, how many did you have last Monday, or the week before, or the month before?
Right, so a month before, so we reached a nadir just a few months ago, one of our lowest points where we were down to 1 to 3 patients for a brief moment, and so clearly this is an increase. I'm hopeful that with the community paying attention to this, pursuing vaccination, where we've demonstrated so many points of access from DPH to our clinics in our communities offering vaccination, that they pursue it. That combined with an increased attention to the things we know help slow this pandemic, masking, social distancing, good hand hygiene, not coming to places of gathering when you're sick, that we won't reach the levels of number of infections that we had during the peaks of this pandemic.
Dr. Davis, if you have a comment, feel free.
I think it was Yogi Berra that said deja vu all over again. Yeah. And also there's a quote that I often remember attributed to Winston Churchill that says nothing is more important to a government than the health of its people. And looking at the numbers and understanding the concern, we would fully support Mayor Johnson's actions here.
I think a lot of people maybe at this point, just maybe immune to information, but it's easy to get vaccine now. You can go to your pharmacy, right? Are they available in a lot of places, right?
Yes. Many pharmacies, the health department, the federal qualified health centers here. We have pop-up vaccination sites that occur, around town periodically that are advertised on our website. We've been administering at the Civic Center once a week. We're actually going to move that to one of the fire stations soon because of allowing the fact that we're going to be allowing some planned events to take place in the Civic Center. But you can walk into the Chatham County Health Department on Eisenhower any day of the week, no appointment necessary, and you can get a vaccine.
I guess this will be for, for the mayor or, for whoever wants to respond to this. How frustrating is it for you to know that this is a vastly preventable situation now just by getting vaccines and stuff like that? How frustrating are you that the vaccination rates are where they are right now?
It's frustrating, it's saddening, and it makes me mad. Because it wasn't that long ago when we were so separated that we didn't see our family and friends. When we were going to funerals of those that we loved, where I would go to our local hospitals and look into the eyes of our healthcare workers, many who had not had a break in weeks, many who told me they held the hands of people because their families couldn't come see them. The many graveside services that I went to because we weren't able to gather in buildings. The virtual worship services because we couldn't gather in person. Our businesses determining whether they were going to open or close because the fact was people were not there. And we are now to a point where we started reversing those things. And yet our behavior has gone, our lack of action has now gotten us back to going down the slippery slope. Masks are, I think, the lowest level and the first step we can take in encouraging vaccination. And I'm just afraid that if we don't, we find ourselves in March and April 2020 all over again. We find ourselves in June of 2020 all over again. It's not fair to the 41% who did what we asked them to do. If you choose not to be vaccinated, then you choose to live with the consequences of not being vaccinated. If you choose not to wear a mask, then you choose to live with the consequences of not being masked. And that is why we're here today.
Good morning, Mr. Mayor.
Good morning.
Savannah Police tells us 6 citations were issued during the last mask mandate. How do you plan to deter people from not masking up this time around?
We're working on that side of it. Again, I don't think it has to be an issue of, forcing people to do what's absolutely right. I'm hoping and I believe that the vast majority of our citizens want to do the right thing. They want to ensure that we are in a place where we can enjoy our beautiful city. And again, people could decide not to, but then, the consequences are what they are. And the consequences are bad for everyone. If we are shutting down events, if we're shutting down various types of businesses, people suffer. And so people have to decide whether their choice is worth the consequence.
And you mentioned, our neighboring counties' high community transmission rates in addition to ours. Does that concern you when you think about people from those counties coming to Savannah, even people from out of state with high transmission index visiting Savannah?
Absolutely. I think that's part of the reason why we are doing this. When we're the regional epicenter for just entertainment, for leisure and things, and again, You know, you have Camden County with 800 our neighbors here in Bryan County. Many people in Bryan County work in Chatham County. In Effingham County, they work in Chatham County. And then you have people coming here from all over the country, coming from places that are hot, and they're coming here and they're not wearing masks and they're interacting with our folks, and then they leave and that virus remains here. So this is really, for us, a preemptive step to hopefully to stem the tide, to hopefully get to a place where we can then kind of reset and relax some of these mandates.
You mentioned you've been in talk with Savannah Chatham schools and you're hoping that will partner with you. What do you hope to see as far as policies for students, teachers, staff inside Savannah schools?
Well, again, this is, for me, we have no jurisdiction whatsoever over the Savannah Chatham Board for Public Education. I want to make sure we say that. This is just my opinion as being the mayor of the largest city in that district. And I'm asking that as we go through this, as we protect them, and they've been really good partners in following the science as well, that they partner with us. It doesn't help us a lot to have the majority of our schools in the city of Savannah, and those young people and those teachers are not masked. Again, I was at the ball with a lot of these young people, and there were kids everywhere. I mean, everywhere. And they want to hug, and they want to, and I air hugged a whole bunch of them. But the reality is that we are approaching a situation where these schools can become hotbeds for infection. And so, I hope they'll consider it. I mean, obviously, if they choose not to, that's totally up to them. But, here in Savannah, we've been very aggressive, very proactive in trying to take measures to stem the tide, and I'm hoping that our Board of Education will partner with us on that.
Thank you. I have a question for Dr. Davis. Good morning, Dr. Davis.
Good morning, I think.
So I know you and I talked last week specifically about Camden County and their increasingly high transmission index there. And you said that you were meeting at the end of last week with some health officials there to kind of amp up vaccination rates there. Just wanted to get an update on that since, as of Friday, it's increased to over 800 now.
Yes, we are trying to increase vaccination down there, and this morning I know that their school board was meeting to consider whether or not to mandate masks in their school system. I participated in the first part of that meeting, but I left to come down here before the conclusion, so I don't know what their final analysis is.
And we know, I believe this is the second or third in the coastal health district mask mandate that's been reinstated now in Savannah. Are you in talks with other parts of the district to kind of encourage this? What does that look like for other parts that do not have this mask mandate?
We advise, we try to share the science and the data, but we don't tell the elected officials what to do.
Thank you.
You mentioned the school district, but you talked with Chatham County leadership about any efforts that they have to bring this back, and something to see them as a partner at this point?
I have not, but I expect to. Again, I think that we're a week away from school starting, and the facts are there. If any figure or fact that I had proposed is wrong, then any of these health professionals would be in a position to say it's true. I mean, it is what it is. We are, again, in that substantial, significant range. We're in the red zone, so to speak, and we have to do something. It only gets worse, and if you look at our trajectory, it has not been on a mild incline, it's been on a steep incline. We're talking about radical changes since just the beginning of this month, and we're not even through August yet. So I think it's a force multiplier for young people to be back together again inside school buildings, and I just think that it's more opportunities for replication, it's more opportunities for more infection, it's more opportunities for people to get sick. And as Dr. Petty referenced, two young people don't have their parents. Both parents died. I mean, that should be enough to say, you know what, maybe we need to go ahead and try this.
Last time during the mandate, the city had folks out on the street handing out masks to people. Do you expect to bring that back? And additionally, if there's a private business who kind of decides not to implement this, will they be cited? Will you guys do more enforcement this time?
Well, the city has a variety of means to include licenses that are held through the City of Savannah. We have means to help them to understand how important this is. And I've informed City Council this morning. As you know, this is an emergency order, and so therefore will need to be ratified by the City Council at its first meeting in August. I would pledge our support. Dr. Davis, if we need to go walking and knocking on doors in our districts and give us a couple of nurses that we can vaccinate folks in their homes, if that's what it takes, then let's just do it. I'm willing to knock on doors every single day, to talk to people every single day about the need for people to be vaccinated. It only takes a moment. As a matter of fact, Mr. Lloyd and I were vaccinated at the same time. I did better than he did, but the fact is that it doesn't take that long. And if you're not doing it for yourself, then do it for the people you care about. And so if we all care about our city, and we say we care about our city, and we know vaccinations rates are the way to go, then we have to do differently. It was said this weekend that Florida accounts for 20% of the new viruses in the country, and we are only an hour and a half, hour 45 minutes away from the Florida border. And folks from Florida come through here all of the time. We need to understand that. And we need to understand what trends mean and how we're so interconnected and interrelated and interdependent that what happens in some areas will eventually come to us. So I really appreciate these medical professionals. They have been of wise counsel to me. This is not a political issue. This is purely public safety and public health. And so I would not have made this decision without the advice and recommendation of those that are behind me, who are way, way smarter than me. This is what they study. They didn't learn about it online. They didn't look up theories and things. Yeah, they went to school. This is what they do professionally. And so when you want professional advice, you seek the professionals. You want expert opinions, you seek the experts. So let's wear these masks. Let's get better. Let's get vaccinated. And may God bless the City of Savannah. Thank you. Yes.
Just have one follow-up, I'm sorry.
Here you go with that phone.
I think it's text.
Yes, sir.
City employees, I know there are some larger cities in America that have required their employees to get vaccinated. Is that a move that Savannah will take at some point?
I think that we're talking. Hopefully, within the coming days, the assistant city manager, acting city manager, will send communication out to our employees, re-emphasizing the need to be vaccinated. If they're coming to work and they're not vaccinated, they're doing this at their own risk. At this point, we're not sending people back to remotely work. They're going to have to work in the conditions and where they are. And so, we know that when people are infected with COVID, even though they might recover, they're often different. Things have changed about them. And so we still don't know what the long-term effects of COVID infection are. That's something that these folks study all the time. And so, we're a public service agency. We work for the public. We work with the public. We interact with the public. And so if I were them and I'm interacting with the public, I'm going to be wearing a mask. Furthermore, I'm going to be vaccinated. So 100% of everybody on this platform today are vaccinated, right? See, how many of y'all are vaccinated? See? Just that easy. And if the smartest people in our community are vaccinated, I'm going to be vaccinated. Thank you.
Sorry. Dr. Dennis or Dr. Zach, I know the mayor. Breakthrough cases. Hey, while you're all here, I gotta get you.
All right.
The mayor touched on breakthrough cases. Can you, again, for the folks out there who are saying, well, what's the point of getting a shot if you're still going to get infected anyway, can you again hammer home that point? And if we've seen, because of these rising numbers, the CTI, people coming to get vaccinated, I know we said the number still isn't where we want it, but is there an increase there? So 2 questions there, all in one, and I apologize.
It is true that people who are fully vaccinated can still contract COVID, particularly with the Delta variant. It is much more contagious than the Alpha variant, which we call the UK variant, and the original SARS-CoV-2. However, the majority of people who are vaccinated do not catch COVID with the Delta variant. And if they are unlucky enough to have what we call a breakthrough case, they're fully vaccinated, they still get it. Statistically, they're much more likely to have a very mild case, and they're even less likely to wind up in the hospital, and they almost never would die. So the population that contracts COVID following vaccination overall experiences a much, much, much less severe clinical course than the unvaccinated population. So nobody, as the mayor said, nobody has ever said the vaccines are 100%, but they surely are good. Now, what was the second half of your question?
With the rising CTI, do you anticipate you'll see the numbers of folks coming to get vaccinated? I know that's the hope, but is that anticipated?
We hope. You know, the sprint part of the vaccination effort took place several months ago. We're sort of in the marathon. We are still chipping away at what we all have come to call vaccine hesitant, the vaccine hesitant population. We're still making headway. We're actually up to 42% in Chatham County and 45% with at least one dose. And there's data from Emory that shows that in that 30 to 50% of people who are unvaccinated that are hesitant and not in the firm camp that I'm never going to get it no matter what. We are making progress, but it's if any of us had a magic recipe that would encourage and induce those people to go ahead and get vaccinated, we'd all be doing it. So it's it's different groups and different sets of friends and cohorts, but we're making progress.
The new goal is 52%. We're at 42, let's get to 52. Let's get to 52. Can we do 10 percentage points? Yes, we can. Let's get to 52, and then let's talk. If we have 52% of our population with at least two doses, I think our chances are a whole lot brighter. Thank you. Thank y'all.